Nonprofit hospitals are granted certain tax breaks, and they are also eligible for deep discounts on their drug purchases as required by the federal government. And what we're discovering is that their obligations to provide charity care are not being met for many hospitals. In return for those tax breaks and drug discounts, they're not giving out as much charity care as they did 10, 15 years ago. In fairness to the hospitals, some of the cause of that is the fact that the federal government has increased the size of the healthcare safety net for low-income people. We've had Obamacare pass, millions of people are enrolled. We had only 40 million people in the federal Medicaid program 20 years ago, 30 years ago, and now there are 83 million. So there are more insured people coming in, but at the same time, they are they're getting deep discounts on drugs and making enormous profits on those drugs. And one would think that if they have more insured people coming into the door, they would not need the same amount of revenue for these other programs. The first thing I think that could happen is a little transparency. How much revenue are some of these hospitals taking in, particularly from this drug discount program, which has exploded in size? And then how much are they spending on charity care? And let's get a uniform definition of charity care. Obviously, when an uninsured patient who's low income comes in and gets free care, that's charity care. But what about a middle income patient who doesn't pay their x-ray bill? Is that written off? Is that charity care? We don't know. And hospitals are all over the map in how they classify expenses like that. So let's have some transparency about how much money they're making and have some transparency on how much money they're spending on charity care. You can go on my website for my think tank, which is pioneerinstitute.org, pioneerinstitute.org. And I've written some papers on this hospital drug discount program and how much profits are being made through that program and how much charity care is being given out. But there are other papers on healthcare and other topics at our site.